Fertility Specialist. Yeah, it's been a while. Good to be with you guys on a day with your fertility specialist. I'm excited to be your host, Ruth Ogogo, and I'm also excited to have, should I call his name now? Okay, yes, let me call his name. Dr. Kenneth. Good. I'm excited to have him with me in today's chat. Dr. Ken, you're welcome.
It's a pleasure.
So, today we're talking about endometriosis. Yeah, this topic has been lingering, and yes, apologies for last week. A lot of things had to be attended to, but right now we're here to attend to the topic, and we're Dr. Ken is fully loaded for you guys. So I hope you're also ready to listen. I hope you're also ready to take your salient points so you're able to get every information needed. On this note, also, we'd love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for staying tuned. It's always amazing to be with you guys on this show. As we get started, call up your loved ones, share this link with someone. If you need to send data to someone, please do that so they are able to get connected to this chat right now and they don't miss out on what you're about to get. Today, once again, we're talking about endometriosis. For someone watching for the first time, yeah, you heard me say Dr. Kenneth Iguda. Just a little about him. Dr. Kenneth Iguda is.
Endometriosis specialist.
Oh, yeah, you can say that again. Okay,
Okay.
so Dr. Kenneth Iguda is a consultant gynecologist, he's an IVF specialist, he's a minimal access surgeon, and a lot more. Just keep checking our previous videos, and you will see a lot about Dr. Ken that would daze you. So, Dr. Ken, we're talking about endometriosis today. Viewers, feel free to drop your thoughts, your comments, and your question in the comment section as we get started, and we'll definitely attend to them appropriately. We're talking about endometriosis. Endometriosis, like, well, this word
You know,
it
just just
sounds.
just just the way it sounds very terrible pronouncing,
Mm,
you really you don't know how to even pronounce it. That is how the
mm,
disease condition is. It's just anyhow.
wow.
Yeah, it's just anyhow endometriosis.
So it
Yeah, it's
seems.
one of the gynecological nightmares,
Wow.
and for
Hmm.
me, a reproductive gynecologist, there are two diseases I that dread me
Wow.
constantly.
Mm-hmm.
I don't want to know that a woman has endometriosis and is
Wow.
battling infertility. I
Wow.
also don't want to know she has adenomyosis,
Wow.
battling infertility,
Oh
because
my
these
goodness.
conditions can actually pose a lot of challenges
Mm,
to gynecologists with respect to getting a woman pregnant.
mm,
So yeah, but it's what it is, and then
wow.
our goal here is to make life comfortable for as many as are battling endometriosis and
Mm,
adenomyosis, and also to find a way to make pregnancy journey a little bit doable for those having endometriosis. It's actually it's just a bad
worrisome.
disease.
Okay, so yes, dear viewers, I know you're just wondering what is this endometriosis that he's talking about. So, Dr. Ken, maybe you should make someone understand what this big word is that we're pronouncing endometriosis. Yeah, that's your field. I'm sure you could do better than I'm
Yeah,
pronouncing.
yeah,
Yeah,
endometriosis.
yeah. So please tell
Endometriosis.
someone watching a little about it.
Okay, so endometriosis actually. Okay, let me start by I try to make it a little bit easy to understand.
Mm,
The woman's uterus.
yeah.
Let me divide it into three parts.
Okay.
You have the outermost part of the womb,
Okay.
which is like the serosa, the
Okay.
covering of the womb
Okay.
outside,
Okay.
serosa. Then you have the muscle of the womb,
Okay.
which is the myometrium, the
Okay.
muscle of the womb. Then going
Mm,
deep inside of the womb, the
mm,
uterus, you have the lining of the womb,
okay.
which is called endometrium.
Okay.
You know,
Okay. Mm.
endometrium is where a woman sheds
Wow.
monthly
Okay.
when she is menstruating.
Oh wow.
It's a set of tissues that has glands, blood vessels,
Mm.
and all of that. A woman sheds that monthly
Wow.
where when she is menstruating.
Okay.
These tissues have life
Mm.
and they have capacity to survive in some other parts of the body,
Wow.
but the nature's place for them is the lining of the womb.
Okay.
Okay, now this lining of the womb is where a baby implants, where pregnancy wants to happen.
Yeah.
It is also the place where, for those who have had D&C, a place where you scrape
Mm.
if you're taking out the baby. You understand?
Yeah.
Yeah. So that's the lining of the womb. So now, I say this to try to explain what endometriosis is.
Mm.
Now, this lining of the womb is originally meant to be the innermost part of the womb,
Yeah.
and if it stays there, a woman is safe,
Okay. Mm.
you know, with respect to the symptomatology of endometriosis.
Okay.
But if it gets out of this innermost part and finds itself elsewhere in the body,
Mm.
a woman has huge problems.
Wow.
And so, endometriosis means having these tissues in the lining of the womb
Yeah.
that's meant to be in the innermost part of a
Yeah.
woman's uterus
Mm.
outside of the womb.
Wow.
So, you could find it on the body of the womb outside.
Wow.
You could find it on the ovary
Wow.
outside.
Mm.
Ovary is outside of the womb again.
Yeah.
So you could find it outside.
Mm.
Then you could find it on the fallopian tubes
Wow.
outside.
Mm.
Then you could find it on the ligaments,
Wow.
the support structure of the womb,
Mm.
you know, which is outside of the womb too.
Yeah.
You could find it in the lungs sometimes.
Wow.
Yes, I'll talk about the symptoms. And
Mm.
occasionally, you can find it in the brain.
Wow.
You can find it in
Mm.
the rectum,
Mm.
and it can make a woman. Okay, we'll talk about the symptoms in a bit. You can
Yeah.
find it in the rectum.
Yeah.
You can find it in the umbilicus.
Wow.
Yes, you have women who, when menstruating, have bleeding
There.
from the
Oh
umbilicus.
my
You know,
goodness.
remember what I said earlier that when this lining of the womb find itself outside the innermost part of the woman's uterus, the womb,
Yeah.
that is what we mean with endometriosis. It means ectopic endometrial tissues finding them. I mean, endometrial tissue now finding themselves
Yeah.
outside the
Lining of the
uterus.
womb. Wow.
You know, even when you find it in the muscle layer of the uterus, for
Yeah.
instance,
Yeah.
it's meant to be the innermost layer of the uterus.
Mm.
The muscle layer is a second layer of the uterus. Okay,
Yeah.
if this lining of the womb endometrium find itself in the muscle layer, it gives adenomyosis, which is also a big
Wow.
problem. Okay,
Wow.
so but endometriosis when it is outside the womb completely, in all the places that I've mentioned,
Yeah.
and then the symptoms depends on where you have it.
Wow.
So that is what endometriosis is. It affects all age group
Hmm.
of people. Young ladies in their teenage age affects them. Middle-aged ladies affect them. Even those getting close to menopause could be
Yeah.
affected,
Wow.
and all of that. And the
Wow.
problems are just too many
So
with it.
endometriosis, from your experience, does it seem to be a really common condition, or you just have 1 out of 10 based on your experience seeing your clients and all of
Now,
that?
I think it is a poorly. It is not often diagnosed.
Wow.
You know, but you only for us who are gynecologists, we
Yeah.
see that when we have women having usually advanced endometriosis,
Hmm.
and usually that is when they are not getting pregnant, when they are married,
Yeah.
or they
Hmm.
have very bad menstrual condition, menstrual pains,
Hmm.
and that's usually when they call the gynecological attention, you know,
Yeah.
yeah, the gynecologist's attention.
Hmm.
But there are a lot of young girls who are having this bad pain
Wow.
during menses
Wow.
and they are not diagnosed
Hmm.
because their parents probably don't see need to see the gynecologist and they
Yeah.
probably see the general
Hmm.
practitioners and all of that. So um, it's common, but it is
Poorly
not well
diagnosed.
reported,
Hmm.
poorly diagnosed.
Wow.
Yeah, so that's just what I can say about it.
Okay, so it's is there a cause, like, okay, do you say there's something that could actually cause endometriosis, or is there a particular cause for it?
Yes, endometriosis has causes.
Okay.
When I was in medical school,
Yeah.
or rather when I was doing residency, during my residency period, we had a lot of diseases that we say their causes are unknown.
Unknown.
But from the level of my medical exposure,
Yeah.
training, and involvement with advanced researches, the cause of everything is known.
Hmm.
Everything has a known cause. You know, genetic predisposition is one of the main causes. There is
Okay.
a gene for endometriosis. You
Wow.
understand? So
Hmm.
people inherit these abnormalities, the
Okay.
gene for these
Hmm.
abnormalities, and
Yeah.
then it expresses itself so easily.
Hmm.
But when you have the gene for it, then you have predisposing factors or
Factors.
things that make those genes get expressed.
Okay.
So yeah. So gene is the first thing we can
Okay.
talk about here.
Okay.
Then secondly, we have behaviors
Oh wow.
or conditions that
Okay.
predispose a woman to having endometriosis.
Okay.
Remember, I said that it's when endometriosis happens when you have ectopic endometrial tissue. That is,
Yeah.
you have this lining of the endometrium outside of the uterus.
Uterus.
Now, there are a lot of things that make the lining get outside of the uterus.
Hmm.
One, there is a theory, what we call transformation theories.
Okay.
When you have the this there's a covering of the body we call peritoneum.
Okay.
So
Okay.
when the peritoneum has a transformation,
Hmm.
and this transformation happens when you have excess estrogen exposure,
Wow.
especially during developmental ages,
Hmm.
so you could have ectopic endometrial tissues, and there are
Wow.
other tissues can also change because of
Okay.
estrogen
Oh
exposure.
wow. Wow.
And when this happened, for instance, you could have endometriosis in the lungs.
Okay.
You could
Wow.
have it in the brain.
Hmm.
You could have it in the intestine or on the
Wow.
intestines, and
Wow.
you could have it in the rectum.
Hmm.
you know but that's one of the theories for endometriosis, when the
Okay.
transformation
Hmm.
of mesothelia of peritoneum. But then you have some physical practices.
Okay.
Now, in this part of the world, we have a lot of ladies undergoing a termination of pregnancies, for instance.
Hmm.
When you're terminating a pregnancy, for those who do D&C, you scrape the lining of the womb.
Hmm.
And the movement for scraping the lining of the womb, it's a back and front movement.
Wow.
And when you're doing the
Hmm.
back and front movement, the lining gets scraped, the fetus or the embryo gets scraped,
Okay.
but you
Yeah.
also scrape a lot of healthy lining of the womb.
Hmm.
And then you're doing a back and front movement.
Yeah.
So the lining you've scraped can actually be pushed through the fallopian tubes
Wow.
and then get through the fallopian tubes
Hmm.
into the pelvic cavity.
Hmm.
And then this tissue get deposited there,
Wow.
and then they begin to act like the endometrium.
In the womb.
So when you have the lining of the womb bleeding, they are also
Hmm.
bleeding over
Bleeding.
there.
Wow.
If it's in the ovary, it affects the ovary, and
Wow.
all of these things
Hmm.
happen. Now, during surgical procedures, for
Yeah.
instance, call it a fibroid surgery or cesarean section,
Hmm.
you also breach the lining of some of these conditions. Shall CS, cesarean section, breaches the lining of the womb.
Hmm.
Then, if tissues are not properly handled,
Hmm.
you may displace the lining of the womb
Wow.
outside, because it can
Wow.
easily break out of the
Hmm.
containment and goes outside of the uterus.
Wow.
And then, depending on where it gets to, during cesarean section, you are exposed to the intestines, you are exposed
Hmm.
to the uterosacral ligaments, you
Wow.
know, because a lot of blood, a lot of fluid spills, and
Yeah.
endometrial tissue may be part of those fluid that is spilling.
Hmm.
And depending on where they spill to, they can get planted in those areas. Now, it could easily be planted on the ovaries, on the fallopian tubes, on the body of the uterus outside,
Yeah.
intestines, and all of
Hmm.
that. Then they begin to, let me use the word like an agriculturist now. They can get planted, they
Hmm.
can begin to grow,
Yeah.
you know, and all of that.
Hmm.
Now, a woman that's having heavy menses,
Yeah.
during menses, uterus contracts and forces out the menstruation. Always not be in favor of outflow.
Oh wow.
It can flow back. When it
Okay.
contracts, it can push blood back. And the
Okay.
only way blood can go back is through the fallopian tubes
Tubes.
if they are
Wow.
open. So it
Hmm.
can get through the fallopian tube and get to the pelvic cavity.
Wow.
And sometimes this can break into other blood vessels
Wow.
and then can be transferred. The whole body is connected with blood vessels.
Yeah.
It can be transferred to other parts, distant parts from the uterus,
Hmm.
and then you could have it in other parts of the body.
The
You could
body.
have it in the
Wow.
lungs, you have it in the brain, depending on
Wow.
how far it gets.
Gets. Wow.
So those are some of the ways. During fibroid surgery, it can happen.
Wow.
And that is why a woman may not have it before, and then she
Hmm.
has this kind of procedure. Maybe
Yeah.
it's CS, cesarean section, or fibroid surgeries,
Yeah.
or D&C,
Hmm.
or evacuation, and all of that. When tissues are not properly handled, they
Yeah.
get dislocated, they get transferred to some other part of the body. Then
True.
you have endometriosis.
Metrosis.
And
Wow.
then during fibroid surgery, for instance, endometrial tissue can easily be buried into the muscle layers of the womb.
Oh,
And then
wow.
adenomyosis could take up from there. Remember,
Hmm.
some of these things I'm mentioning may not be in the conventional books,
Hmm.
but they are all risk factors, you
Wow.
know, and these are ways women come down with endometriosis,
Yeah.
and then the symptoms they show may be dependent on where the endometriosis
Okay, so just before we talk about
deposited.
symptoms, so dear viewers, you see why it's actually important that you seek health care from a very, very good physician or a very, very good specialist like Dr. Ken and the ALPS team. Because I can imagine someone now that comes down with endometriosis secondary due
Mm,
to possible
mhm,
malhandling of some of these procedures that he has
mm.
mentioned. So please, if you dey follow person, follow who no road. I mean, that's how they
And then
used to say.
for some of us, I'm a reproductive surgeon, for
Yeah.
instance. Our approach to surgery, it's a lot different from the general gynecological
Mm,
surgeons. You know, when we operate a woman, for instance, we operate her with the knowledge that she may want to get pregnant. We
mm,
operate her with the knowledge that tissues that are not native to certain areas of the body could become problems if they find themselves in those areas. The way we are trained to cut tissues sometimes is different from the
mm,
way the general surgeons or general gynecological surgeons are trained. For
mm,
instance, we don't cut across blood vessels
wow.
when we're dealing with the ovaries. We cut along blood vessels, so we don't transect blood vessels. So we cut the ovaries and fix the ovary, and the ovary is still functional without having so much reduction in the
Mm,
quality and function of the
the
ovary. But when
ovary.
you cut through the blood vessel, for instance, you have compromised the blood
Blood
supply to the ovaries,
supply.
and you've compromised the function and the longevity of the ovaries.
Mm,
So reproductive surgeons operate women differently, for instance,
true.
and then we're careful about making a life complicated for a woman when we deal with them. So
Yeah.
our approach is a little different. So you could see, doing fibroid surgery, you're giving a woman endometriosis.
Yeah.
Doing a cesarean section, you're giving a woman
Yeah.
endometriosis.
Mm,
There are women who have had cesarean sections, for instance, and then they start having pain on the scar
yeah.
of the cesarean section. That's after the
Mm,
skin has healed.
yeah.
And then whenever they are menstruating, they have pain on the scar.
Wow.
Or when they are ovulating, they have
Mm,
pain on the scar. So you see, the surgery has translocated
wow.
a tissue of the endometrium
Oh
to
my
the skin.
goodness. Wow.
And so she had a surgery that apparently looked successful, but she ended up
Yes.
having a complication
From
that the
it.
operator doesn't even know he had caused. And this is
Yeah.
because tissues were not properly handled. So it's good to know the kind of surgery you're doing, and it's good to know who you permit to operate you, because it's not how fast a surgery goes, but it's
Yeah.
how well a surgery
Mm,
goes. You
yeah.
should operate with good skills, and you should be careful not to distribute tissues to places where they are not meant to be.
So viewers, this is actually I think Dr. Ken should give this lecture to group of gynecologists.
We do that. When we have
Yeah.
training sections
Mm,
to conduct for gynecologists or reproductive surgeons. Yeah, so this is how we do talk to them. And
mm,
so it's not difficult for the general public to also understand. But when we get
yeah.
to professional levels, we talk like we're talking to
You're getting a lot, and I know you are taking
mm.
notes. Please call up someone. If you need to share this with someone that you've not done, please do that right now. And let me see your like buttons popping up as we continue with this chat. So now, yeah, you were going to talk about symptoms before I got you to talk to my
Mhm.
dear viewers. Okay, so how does a woman get to know that she's having endometriosis? Are there things that she sees, or is there a way she feels that makes her know, okay, I think I might be having endometriosis? Or are there ways that are there tests that she would do or something? What exactly?
Oh yeah, now that you mentioned tests,
Hmm.
let me start from the test
Okay.
perspective.
Okay.
Yes, let me start from the test perspective.
Okay.
Just this year in in the Netherlands,
Okay.
is it Netherlands? No, in the United States. Sorry, in
Okay.
United States.
Mm.
In the United States. Last year in the United States. Sorry, October
Okay.
last year in the United States, Colorado. We had a meeting with a
Okay.
group of persons.
Okay.
International collaboration for endometriosis care,
Yeah.
and we were planning to start just blood testing to
Okay.
know a woman that is at risk of having endometriosis,
Mm.
so you could advise and counsel them on the lifestyle
Yeah.
and how to save their fertility.
Mm.
So we're getting to a point that you could take, that's why I told you that it's genetic.
Yeah.
You could take a blood sample of a woman,
Mm.
and then you could tell whether or not you could have endometriosis. So we have a group of people coming out. And incidentally, I was in
Wow.
that meeting. And there
Wow.
was another Nigerian, well, two Nigerians in that meeting in
Okay.
Colorado. So we're
Okay.
looking at testing. And then
Wow.
this can involve countries in Africa where
Okay.
samples can be taken, and we begin to fish out ladies that could have endometriosis.
Okay.
Yeah, so there's testing that could
Okay.
be done, but it's not available yet
Mm.
in this part of the world.
Yeah.
But we're warming up because some centers in Nigeria will be selected. We're
Okay.
just looking at the costs of the tests,
Mm.
and decide which categories of
People.
centers
Mm.
could be selected to be part of. All of this is in an attempt to help curb endometriosis. So
Mm.
back to the symptoms.
Yeah.
The symptoms often is painful menstruation,
Oh, wow.
very painful menstruation.
Mm.
So yeah, there are some menstruations that are painful that are not necessarily sinister, primary dysmenorrhea, all of that.
Mm.
But endometriosis come often with painful menses,
Okay.
just the way adenomyosis does. It comes
Mm.
with very painful menses. The menses could be very heavy occasionally, it could
Mm.
just be normal.
Mm.
So those are some of the symptoms. Then
Okay.
a woman may be stooling with blood
Wow.
when she's menstruating.
Okay.
It just shows that she has endometriosis deposits in the
Mm.
rectum or in the
Rectum.
anal region.
Wow. Wow.
Then, of course, you could have a bleeding through the navel,
Wow.
umbilicus,
Mm.
belly button,
Yeah.
if you have deposits around that place, around the umbilicus. Then, for some other people, you could have coughing and you're bringing out blood.
Blood. Wow.
It also means that you probably will be having endometriosis around the
Wow.
chest region in the
Wow.
lungs. For some people, they have sudden collapse,
Hmm.
because they have some bleeding into the
In the
brain.
brain. Wow.
Because what happened is that those endometrial tissues
Yes.
outside behave like they
What
are
is
in the
inside?
lining of the womb. So
Wow.
if a woman is bleeding,
Hmm.
having a menses,
Yeah.
she's also bleeding where she has a deposit.
Wow.
And this tissue responds to the hormone changes in the
Hmm.
month.
Wow.
So if she's bleeding during the menses and she has a deposit in the lungs, she's going to be
Yeah.
bleeding into the lungs or around the lungs, and then
Wow.
she could have cough with
Bloody.
bloody
Mm.
sputum. You
Wow.
know, then if she has it deposited in the ovaries, for instance, when she's menstruating, she's also bleeding into the
Into.
ovaries, and
Wow.
then we'll have what we call the endometrioma. So
Hmm.
you have something that looks like a follicle, but it is full of blood, and the blood is usually very dark brown blood,
Oh
like
no.
coffee color, like chocolate color, and that is why they are
Wow.
called chocolate cysts.
Cyst. Oh wow.
That's why they're called chocolate cysts.
Hmm.
Then, because of all this abnormal bleeding, now and then you're bleeding, and it's bleeding stops and all of that. They have high tendencies of having scar tissues around the pelvis. And when they have scar tissues around the pelvis, around the fallopian tubes can go blocked,
Hmm.
and then pregnancy becomes a big problem. Then it eats up the ovaries and compromise the woman's ability to produce good eggs. And so you often see them coming in for IVF as young as they are,
Hmm.
but not having good eggs at the same time.
Wow.
So these are all kinds of symptoms that you could
Symptoms.
have,
Wow.
the
Wow.
pain and all of that.
Wow. So this endometriosis is just it's something that really bites hard and so hard on the woman.
Mm.
I was just going to ask, does it affect a man? But I know. That's
Oh
on the lighter
yeah.
note.
It doesn't
That's
affect
on the
your
lighter
man.
note. Okay, so how does it impact fertility generally for a woman? How does it impact her fertility, endometriosis?
So now it gives women often what we call the frozen pelvis. Frozen pelvis.
Okay.
When you have recurrent bleeding, periodic bleeding, and into the pelvic cavity, structures are rubbing against themselves. The fallopian tubes rubbing on the pelvic wall, rubbing on the uterus, rubbing on the ovaries. Over time, adhesions, scar tissues form around all the structures, and it
Hmm.
tends to bind the structures together.
Hmm.
And when these
Wow.
structures are bound together, the anatomies are lost. And
Hmm.
because the anatomy is lost, the functionality is also affected.
Hmm.
So often you see them having bad fallopian tubes,
Tubes.
bad
Wow.
ovaries.
Oh no.
Sometimes it's so bad that even the intestine can get attached to the fallopian tubes, get attached
Oh
to the uterus,
gosh.
get attached to the
Hmm.
ovaries. At surgeries, you run into complications easily because of risk
Wow.
of not being able to separate these tissues so
Yeah, that's right.
easily.
Hmm.
So a lot of adhesions. So when you have all these adhesions, it makes it difficult for operations, for surgeries. It makes it difficult for pregnancy procedures.
Hmm.
And so this is how it causes infertility. It causes
Wow.
either the tubes to be diseased with fluid hydrosalpinx blocked
Hmm. Wow.
and altered
Oh, a lot.
anatomy. And so the process of pregnancy doesn't just come easy. And then it elaborates a lot of chemicals,
Hmm.
that impedes sperm uptake,
Wow.
sperm speed,
Oh, wow.
air qualities,
Hmm.
and reduces a woman's chance to getting pregnant.
Yeah, speaking of egg qualities, based on your experience,
Hmm.
how was your experience like with people that have endometriosis and they insist on wanting to use their eggs for IVF treatment? Most of the time, what's the prognosis like for them?
Yeah, I think the prognosis is guarded. That's the word
Okay,
I'll choose to use.
okay.
It's an unsure prognosis,
Hmm.
but their likely outcome is usually lesser or lower than those who do not have endometriosis.
Metriosis.
So it
Hmm.
affects fertility negatively.
Hmm.
It reduces their chance of getting pregnant, it reduces their chance of even producing good eggs. Sometimes when endometriosis get to the ovary, that's usually the advanced grade of endometriosis, grade 4 and
Yes,
all of
yes.
that. So the egg reserve, it's affected negatively.
Wow.
And so they usually run out of eggs early in life than those who do not
Hmm.
have
Oh no.
endometriosis.
Wow.
Yeah. And so that is why it's advisable if a woman finds out she has endometriosis, for instance. In some countries where you have protocols for treatment of people,
Yeah.
you want to do whatever kind of treatment to get their eggs and freeze them,
Hmm.
or fertilize the eggs and freeze, cryopreserve them, and then treat the endometriotic condition, maybe
Hmm.
surgically or use of medications and all
All
of
of
that.
that.
And
Wow.
then you can now deal with pregnancy later. But then
Hmm.
you've banked some gametes for them.
Garments.
Because
Wow.
the more advanced or later you get with endometriosis, the poorer and poorer the pregnancy prospect or fertility prospect
Prospect.
becomes.
Wow. So, for someone watching, I hope you're getting a lot about endometriosis. And Dr. Ken has also talked about the symptoms, how you get to know you have endometriosis. He has also talked about the impact of endometriosis on a woman's fertility. And yeah, so what would be your counsel to someone that has been battling with this condition, endometriosis? What's your counsel to them? Because I know we might have quite a number of them. Sometimes when the flyer goes and people see conditions that are peculiar with them, they want
Hmm.
to get glued
Hmm.
to the screen and let's get what the new thing, the new catch. What will be the new catch today for them? So,
Yeah,
what's
I
your
think
counsel?
visit a gynecologist
Okay.
and try to understand the extent of your disease condition. If you have it,
Hmm.
then sincerely talk about pregnancy prospects. If you're interested in fertility, talk
Hmm.
about pregnancy prospects, because you may just be 20 years now, and then
Hmm.
you don't even know when you're going to get married, when you're going to start having kids and all of
Yeah.
that. So talk about that now, because you may be able to to uh, to save your fertility, and preserve your fertility prospects, and so you could have babies or kids later if that's important to you. Yeah. So fertility preservation should be very keen when you talk with the specialist. But basically, see the specialist, understand what it is, have a diagnosis, and take it out from there. I remember I've had to do laparoscopy
Okay.
for teenagers.
Wow.
Yes, with endometriosis.
Okay.
Yes, and then the conventional gynecologist will feel that it is not right, but it's a disease condition. You need
Yeah.
to know it so you could advise this young fellow on how to go about life and the
Hmm.
prospects of life. And for those who are not married, we've had to do laparoscopy, hysteroscopy, and
Wow.
all of that to understand the extent of this disease, because it helps you in counseling with them. And some of this
Okay.
counseling has to do with the parents,
Yeah.
so you understand what your kids are
I'm
going
going
through
through.
and
True.
know what the prospects for the future is
Yeah.
and what advices you need to give them. And
Yeah.
also you decide on how to slow down the disease progression. So you need to
Yeah.
have a diagnosis. So but when we have this blood work coming on, you know then maybe the rate of surgical intervention may become a little lower
Lower.
for diagnosis and all of that.
Yeah.
So yeah.
Okay. So, well, okay, this is more like a comment from one of our viewers. Tammy J is saying she had a thyroid surgery at Alps Hospitals and that she can attest that she has no regrets and that the healing was perfect. There was no complication. So she's saying, well done to you, Dr.
Oh
Ken,
wow,
and the
nice to
Alps
hear
team.
that. Nice to hear that. Yeah.
Yeah. So Tammy J, thank you so much for sending this to the apps team. Yeah, it's good to hear this comment from you, and we really appreciate the comments. Okay, and then you have a question coming up. Are there medications to ease the pain resulting from this condition? That's endometriosis, I guess.
Yeah, yeah, there are medications,
Okay.
and the medications you give a woman depends on her stage in life, whether or not fertility is important at that point in time. Basically, for those who are having pains, you could do the pain relief, giving the non-steroidal anti-inflammatory medications.
Okay.
But of course, there are a lot of hormonal medications that could be used too.
Okay.
And usually, when you're using the hormonal medications, pregnancy is not in view, because
Mm.
you don't do that and get pregnant, except it is part and parcel of an IVF treatment, because some of the medications used for treatment for endometriosis could be used in some phases of IVF treatment.
Okay.
So yeah, there are quite a number of medications, the pain relief, the hormone medications, and all of that. But the doctor seeing them will make a decision based on their peculiar circumstances. Yeah.
Yeah, so for this person that asked this question, we would rather not talk about the medications particularly, so you don't go and do over the counter prescription.
Yeah, and some of this medication you can't even just administer it yourself because it's only
Mm,
professionally prescribed. Because some part of the treatment is you induce menopausal states in
mm.
these women so they don't menstruate, and when they don't menstruate, the symptoms are reduced and all of that.
So yeah, you could book an online consultation to see your doctor, or better still, come for a physical consultation, and then you would get the proper treatment and attention that is required of you. So, dear viewers, this will be all for today. It's been amazing having you, Dr. Ken, with
Hmm.
us
Hmm.
today.
No,
Thank you,
but
dear viewers.
don't just end.
Okay, I even have I just
Don't just
okay,
end. It's
so
good to say that they can
yeah,
get pregnant spontaneously
okay.
without help. That's the
Mm.
truth.
Oh wow.
Depending on the stage of the disease, they can
Okay.
just get pregnant, and
Oh
the
wow.
whole period of pregnancy, the disease condition is under control because she will not menstruate, and so there's no progression of the disease. But for
Yeah.
a good number of women with fallopian tubes being affected, they may need to have a assisted reproduction
Production
technology,
technology.
IVF, and usually it's difficult to get eggs from them when the
Mm.
ovaries are affected. So it's difficult to get eggs, and some will actually require donor eggs, no matter
Oh
how young they
wow.
are. Especially
Wow.
when they have that grade stage 4 or grade 4
Mm.
endometriosis with all the ovaries being already taken up. So I
Yeah.
think it's good to end on this note.
Okay, so I
Yeah.
think it's because of this person as well that you had to chip this in, because the question just popped in when you said don't end like that. So this person is asking, does endometriosis ever go away? Oh my
No, it
goodness.
doesn't go away. Once it's there, it's there. It's only menopause that takes it out, because at
Mm,
menopause, your reproductive life is already winding down. The
okay.
feeds for the endometriosis is taken out because you may not be menstruating at
She was
that
saying she has
point.
seen quite a number of women in their menopause and they still complain about the pain.
Oh yeah, that's interesting because complications had already happened.
Hmm.
So they battling the fallout of the complications. But with
Mm,
respect to menopause, when there is no menses, there is no progression of of endometriosis. So that is when an end comes to the disease condition.
Okay, so these viewers, you don't want me to end this show. So another question just popped up. Okay. So this person is asking, swollen legs during periods, could it also be a signal to this condition?
And it's not very likely,
Hmm.
except it is far fetched. Just that just talk it slowly, and I think you set the mood. It's a very happy mood for me. I like it. Endometriosis.
Waiting they off the system now.
Don't say not tired now. Stay not tired. Overheating.
So the part I ended now will not show.
It just where did it end?
So it was at that when you ran, that was where the thing freeze.
If it freeze, I think it's still airing now. Is it that your own has to be airing before they see?
Yes.
Ah, okay. So it's ending abruptly then. It's all part of it.
We decided to be posting testimonials, so let's be so that they will be
Yeah,
they are bringing their testimonies.
I did production. Might
So
finish
that we'll be
going.
hearing it.
I will call you.
That's amazing.
So the person is not concerned about privacy.
That testimonial was
Yes.
yes.
So for the person to go
Okay, yeah,
like
exactly. Yeah, it's true.